I will be demonstrating the procedure for clinical examination of the breast. The first step is to greet the patient. Make sure the patient is comfortably seated and then explain the procedure and the reason for examination of the breast to the patient. If there is a male doctor or nurse, in that case, a female chaperone should always be present during the breast examination. After explaining the procedure, the patient may be asked to remove her clothing so that both breasts are visible. The two techniques for clinical examination of the breast is first to inspect the breast, following that to palpate the breast for any abnormality. For inspection of the breast, first the patient should be seated comfortably with her hands on her lap. Following that, you may ask the patient to raise her hands and place it on her hips and press down so that the pectoralis muscle is contracted and the breast is more clearly visible. Third, she should raise her hands and place them above her head and gently lean forward so that any abnormality of the breast is enhanced. The things to look for during inspection of the breast are first, the size and shape of the breasts, secondly, the skin for any kind of dimpling or withering, which is also called peau d'orange, and third, to look for any discharge from the nipple, whether it be watery discharge or bloody discharge. After the inspection of the breast is done, you may ask the patient to lie down and place one hand after another on below her head. So while examination of the right breast, you may ask the patient to put her right arm above and below her head, and while examination of the left breast, she should similarly place her left arm above and below the head while lying down. Following this, you expose the patient and then continue palpating her breast. For this, you may want to use PPE or gloves. If not, because it is sometimes better palpated without gloves, so in that case you must wash your hands and sanitize them before starting palpation. The method of palpation is done by using the pulp of the first 3 fingers and not the tip. So using the pulp of the fingers, you palpate the breast gently, first using light palpation, and then following that you palpate deep in order to look for any mass which is deep seated in the breast tissue. So there are 2 main techniques to do this. First, we can follow the spiral technique where we start from outer region of the breast and palpate the breast spirally from outwards to center till the entire breast tissue is palpated. The second method is the vertical strip method, where we start from one end and continue palpating in vertical strips such that the entire region of the breast is palpated. The area to be palpated extends from the middle of the chest to the middle of the axilla. So the entire area from the breastbone to the middle of the axilla should be palpated, and from top to bottom the entire area from the clavicle till the last strip should be palpated to cover the entire breast tissue. So the technique is to use the pulp of the 3 fingers and slowly palpate from the outer region of the breast in spiral motion towards the center of the breast. It is important to also palpate under the axillary region because some of the breast tissue extends right up to the axilla. So here the tissue should be palpated till the region of the axilla. When we palpate the breast, we look for any tenderness and any mass or swelling in the breast. If there is a lump or mass felt in the breast, you should check for the consistency. Normal consistency of the breast sometimes for some women is lumpy, so that may be ignored. But if the mass is hard and uneven, or if it is attached to the underlying muscle such that if you try to move it, it does not move, or it is attached to the overlying skin such that the skin dimples when you press on the mass. These are signs of concern and the patient should be further referred. After palpating the entire breast, we move to the areolar and nippular region to look for any abnormality or discharge from the nipple. For this purpose, we palpate the areola gently and then palpate the area of the nipple to see whether there is any discharge, serous or bloody discharge coming out from the nipple. This procedure is repeated for both the breasts. Following this, you may ask the patient to sit up again and inspect the lymph nodes. We cover the cervical and axillary lymph nodes because these are maybe usually involved in case of any breast abnormality or tumor. So for axillary lymph node, you make the patient sit. In order to palpate the right axilla, you ask the patient to extend the right arm, hold the right arm with your right hand and use your left hand to palpate the right axillary nodes. Similarly, to palpate the left axillary node, you use your left hand to support the patient's arm and use your right hand to palpate the axillary nodes on the right side. When palpating for the axillary nodes, be sure to cover all the groups of nodes including anterior, posterior, lateral, medial and central nodes. Following this, you may also want to inspect the cervical lymph nodes, which might also be involved in some cases. This is done by standing behind the patient and palpating the nodes from the subclavicular, supraclavicular to the remaining cervical nodes. In case you detect any abnormality, inform the patient of the abnormality that you have detected on breast examination and refer her appropriately to the higher center. Once you are done with the procedure, thank the patient, wash your hands and then you may finish the procedure. Thank you.